My name is Eric Chaconis. I'm the Associate Dean of our physical therapy programs. I'm a physical therapist. I've been a physical therapist for 21 years and spent the last like 10 years in academia. My role, I kind of oversee all of our physical therapy programs. I'm going to talk a little bit about our different programs and what we offer at Bellin College. But obviously, you all here tonight are interested in our Doctor of Physical Therapy program. And so we'll do a deep dive into that program. Um, so I'm going to give you a little rundown of kind of who we are at Bellin College and all the details of our program, and really specifically information related to admissions and applying to our program and stuff like that. Obviously, you all have done a lot of research. You know what a physical therapist is, what we do. From our angle and our philosophy at Bellin College, we believe in this idea of the physical therapist as the human movement expert. Um, we believe that not only does the physical therapist help people recover from pain and injury and disease, but we also have this really critical role in prevention and health promotion. And so the physical therapist of today and of yesterday is probably not the physical therapist that our healthcare system needs for tomorrow. We have a major problem in the United States in that our healthcare system is going bankrupt. We are not doing a good job of treating disease. We are doing everything retrospectively. We're waiting for you to get diabetes. We're waiting for you to get heart disease. We're waiting for you to get osteoarthritis, and then we are intervening, oftentimes with drugs and surgery and imaging, and it's very, very expensive and it's not super effective in some cases. We believe that the physical therapist needs to take a health coaching leadership role and be that preventative healthcare provider who prevents people from getting diabetes. It's not hard to prevent you from getting diabetes and heart disease. That is not a difficult thing to do. We just, for whatever reason, don't incentivize that in our healthcare reimbursement model. And so there really isn't a healthcare provider that does that. But we have some innovative ways and innovative examples of physical therapists out there in the field that are doing that. And that's something that we really preach. So if there's one philosophy that you're going to see threaded throughout our program, it's this idea of lifestyle medicine. It's this idea of nutrition coaching, exercise coaching, and kind of being that healthcare provider that helps people prevent disease. I think you all know about the traditional practice setting. So most physical therapists will practice in an outpatient orthopedic clinic where patients come in and see them in the office. Many physical therapists practice in a hospital where patients are being seen right at the bedside and being treated in the hospital. Some at skilled nursing facilities and rehab hospitals where the physical therapist plays a critical role in getting people functional and up and moving and out of that facility as quickly as possible. Of course, there's home health care, there's neurological settings, there's pediatric settings, there's cardiopulmonary settings. Physical therapists practice wound care in some settings. There's a lot of things that we do. Aquatic therapy, sports, team sports coverage. I've had a lot of former students that work in professional sports in the NFL and the NBA and the NHL. That is a popular place for physical therapists to work. And there's a pathway for each of those. Each of those settings and end goals, there's a pathway for it. And you got to do the right things and make the right decisions along the way to achieve that goal to practice in that setting you want to practice in. But we also like to highlight non-traditional settings. So physical therapists opening up a small practice in a gym, working directly with an employer. So if you think of think of like a big manufacturer in Northeast Wisconsin, going and contracting with that manufacturer and providing care in their facility to prevent injury, to prevent disease, that saves them a ton of money. Employers and manufacturing facilities, they really, really like that. So there's tons and tons. Yeah, NEW Community Clinic. We'll talk about that a little bit. The Northeast Wisconsin Community Clinic that we have a facility in too. So anyway, it's an exciting time to be a physical therapist. This is a wonderful profession. The idea that you can use your hands and your brain to prescribe exercise, and to educate people, and to use manual therapy to get them moving and get them functioning without drugs, surgery, or imaging, right? That's a really powerful thing. It's a powerful profession, and we're excited. We're excited about it. So we are a small healthcare focused college in Green Bay All we do is healthcare. That's it, nothing else. We were originally founded in the early 1900s as a college of nursing. So Julius Bellin was a physician. He opened his own hospital, and to train nurses to work in his hospital, he created a college. So it's kind of neat. Think of all those years back, what was going on here, and it's evolved a lot today. So we've added a ton of different programs over the years beyond nursing. It's still known as a big nursing school, a very popular nursing school, but we also have a lot of radiological programs. So people that want to work in MRI and X-ray, sonography, that's a really strong program we have. Surgical assistants, radiation therapy for an oncology type of setting. And then obviously all of our different physical therapy programs. So we have 3 physical therapy programs right now. The Doctor of Physical Therapy program is the one you'll be applying for. So you graduate with your bachelor's degree, want to become a physical therapist, you're going to enroll in a DPT program. After that, we also have a fellowship program that is nationwide. So we have fellows all over the country. And so that is like, you think about post-graduation, you're going to do a residency, you're going to do a fellowship. It's an area of specialty training. So ours is in orthopedic manual physical therapy. That's a very strong element of our DPT program because we have that orthopedic manual therapy fellowship. And then for those that want to go on to do research or teach, we have a Doctor of Science program. So it's similar to like a PhD Doctor of Science program where they're just conducting research and learning how to teach. Also a nationwide program. We get physical therapists all over the country that enroll in those programs. To get into the fellowship program, you got to be a physical therapist practicing for 2 years. To get into the Doctor of Science program, you have to be a physical therapist who has fellowship training. So you're already completed a fellowship. Those programs are pretty new. We started all this in 2019. I live in Northeast Florida. I kind of oversee all programs. The 2 programs are remote, and then our Doctor of Physical Therapy program. But then we also have a director that oversees the day-to-day operations of the DPT program in Green Bay. But yeah, it was all started in 2019. They started all these programs. I got hired then, and we've just been kind of growing ever since. This is our mission statement. It kind of fundamentally describes who we are and what we believe in. And so we absolutely believe that you need to be an autonomous doctor of physical therapy, meaning that you don't rely on prescriptions or you don't rely on support necessarily from another provider. You can provide care on your own. That's an old thing from back in the day when physical therapists used to only get patients from referrals from healthcare providers like physicians. And we've evolved beyond that nowadays. We still get lots of referrals from physicians, but as a physical therapist, you can stand on your own 2 feet. You can treat patients without any insight or information from another provider. At the same time, you want to collaborate because healthcare is a team-based profession, right? And so you want to collaborate with other healthcare providers, physicians, nurses, everybody else that makes up the entire healthcare team. You must collaborate for the benefit of the patient, right? That's really important. We are a research-focused institution in that we infuse everything that we do with research. We love to utilize research to the best of our ability to treat patients in the most contemporary and successful way possible. So everything we do has evidence in it, as much as evidence exists. And then what we try and do with you is really help you become a person-centered clinician who is going to be accountable to your learning and to your excellence. We promote excellence in everything that we do. And so we're going to push you. We're definitely going to push you outside of your comfort zone. And sometimes that is challenging, right? But that's what helps us grow. So we push you, but we do it with love, right? We do it with love. So we're always thinking of your best interest in mind, but sometimes your best interest is not what you want or what you want to hear, right? Your best interest is the clinician that you can become and the success you can have in your career. And sometimes that means failing exams and failing practicals. Sometimes that means having to really, really work harder than you've ever worked before in your life. But the end result is really worth it. And then lifelong learning is really important to definitely. We want you to definitely stick your neck out, that's for sure. Lifelong learning is critical because if you only practice what you learn when you're in PT school, you are not going to be a great clinician, right? You have to develop the tools and the skills to be able to synthesize evidence and be able to know how to learn and how to continue to learn after graduation, that's really, really important, right? Because we've got new research coming out every week. Tons of, I mean, the plethora of evidence today is so significant that you really have to be on top of it as you graduate and go all those years throughout your career. Everything we do it with you in mind. What makes us special and what makes us really, really a strength of our program is we are small. It's a small family atmosphere, and you can tell that when you interact with Steven and he picks up the phone and immediately talks to you and wants to get to know you and understand your situation and how to best help you. Everything we do is with you, with interest, with your best interest in mind. And like I said earlier, sometimes that's not what you necessarily want, but it's with your best interest in mind. And so I love that we have the ability to make changes on a dime, right? Something's not going well, something we learned something, it's not working the way we hope it to work. We immediately change because we always think like what's going to help the student the best. And so that's really a strength of this program. We graduated 2 classes so far. We had our first class graduate 2025, just graduated our second cohort in 2026. And so it's really been fun to see them out there in the workforce and having success now as alumni. When you come to our campus, you got to come to our campus too. Come and visit and see it. We do an interview day, so we'll talk about that at the end, but you'll come in for interview day in November. You'll get to tour the campus. You'll do your interview and all that sort of stuff. You'll see it's a very small facility. We have this building that's on Development Drive. This is our Michael Van Aston campus. And we kind of occupy half of the entire first floor. And then we use a lot of the classrooms upstairs as well. But it's not a big campus. There's no football team. There's no football stadium. It's not like that. There's not even a restaurant or a place to eat. We have like a common area, but it's more like a microwave and a refrigerator and a vending machine, right? You bring your lunch to school, you save a little bit of money. It's actually a better model. But it's been renovated recently. We renovated this building in 2022, or 2022, 2023. And we've outfitted it with everything that we need to provide you with a great educational experience. I'm going to talk about some of the off-site stuff we do, but you're on campus every day, pretty much. This is our lab where we do a lot of our orthopedic manual therapy coursework and different courses where we're doing a lot of our different testing and different procedures and stuff like that. So we got the high-low tables. And it's a pretty relaxed environment where we're really just trying to make sure you're comfortable there while you're learning pretty much all day long, right? You're there a lot. And you get to know your classmates really, really well. You become a family. You're doing everything together. This is one of our lecture classrooms upstairs. This is our kind of exercise facility. It actually looks a little different now. We got a squat rack in the corner, a couple of the machines in there. But we do a lot of our kind of movement stuff and exercises over there. We like to utilize a lot of our community partners pretty heavily for learning. So if any of you have been near Lambeau Field, you have the Titletown area, the Amplify Health Titletown Sports Medicine Facility. I got to get a new picture. It's not Bellin Health anymore. It's Amplify. But anyway, this Amplify Titletown Sports Medicine Orthopedic Facility is an amazing facility that we use somewhat heavily for some labs. So like they have this big, huge gym area with the turf field, lots and lots of equipment, squat racks and all sorts of stuff. They have a really strong motion analysis technology there. And so we do throwing analysis, gait analysis, running, all the different lifts, force plates. There's treadmills with analysis, bike fitting. So we use Titletown for that. And then some students do internships over there at Titletown as well. We go to St. Norbert College for our anatomy cadaver labs. So we have Dr. Deborah Anderson, who teaches Medical College of Wisconsin medical students there in that anatomy lab. And then she also teaches our DPT students anatomy. So it's a really great relationship we have with them, where we go over there 2 days a week and we're in the cadaver lab, working on our cadavers. This is the YMCA. So we do a lot with the YMCA. On the left, you can see this is our YMCA Parkinson's program, where we have individuals from the community come in who have Parkinson's disease, and they work with our students once a week. It's faculty led. We got all our faculty. We got faculty there, students there. You kind of rotate through that on Thursdays. We also do a lot of different community fundraisers and stuff like that with them. This is Spin for a Cure, where we're fundraising, doing spin classes, and then we use their pool for our aquatic therapy labs. So we have a really good relationship with the Y. You can get a membership at the Y for $5. They have a thing with us where they'll let all students get a membership for $5. So it's a great place if you want to work out before or after class. Really close to campus. Other community events. We're really big on community service. We're really big on community partnerships, and you're going to create a portfolio as you're a student with us about all the different things you do in the community. So we really like students to get out in the community and learn through service, learn through leadership. This is adaptive rock climbing, where our students went there to work with people who have different injuries and disabilities to do adaptive rock climbing. This is the Sybil Hop School, which is a pediatric developmental school that our students go that are interested in pediatrics, go and volunteer there and help out working with the kids. We go to Guatemala once a year. We did our first inaugural Guatemala trip last year. I was lucky enough to join the team and do that. That was really fun. So we go to the east coast of Guatemala, to Puerto Barrios, and there's all these villages around Puerto Barrios that people really, really need a lot of help. And so we go into the villages, we take these little vans into the villages, we bring our treatment tables, we put them on our back, bring treatment tables out there, we provide care to the residents in the communities there. So it's a really fun trip. I think we had maybe like 12 students go, something like that. We did some other fun things. We collaborate with the nursing staff at the local hospital, did some educational stuff for them. And then they have a PT school there in Guatemala, and we collaborated with the PT students. We had our students teaching the Guatemalan PT students different manual therapy techniques, and we kind of did a collaborative learning thing. It was a lot of fun. The NEW Community Clinic that was mentioned earlier. So that is a reduced cost or free healthcare clinic in Northeast Florida. It's in downtown Green Bay. We created a physical therapy clinic there. So patients that are in need of physical therapy services come to see us. Same thing as the YMCA. You rotate through there on Thursdays and you see patients at the NEW Community Clinic with your faculty there mentoring you. We also like to get out to advocate for our profession. So we try to go when it's available to Madison, to the state capitol, to the Hill Day, where we advocate for different issues. This is a group of students that went last year to advocate for some scope of practice bill that we were working on in collaboration with APTA Wisconsin. And then getting out to your own unique individual things. So this was kind of cool, is that we had this student, Alex Shutter, from our 2025 class. And he came to me and he said, I'm really passionate about golf. I want to be a golf physical therapist. Golf is where I want to spend my career. I want to be on the PGA Tour someday. And so I said, you got to meet this guy. I had another friend who has a golf specific PT clinic in Florida. I said, you need to go meet this guy and you need to collaborate and you can learn a lot from him. And so Alex started on the semester breaks between semesters going down and visiting Layton. The PT down there, he developed a relationship with him and kind of got mentored by him. And Layton connecting him with a bunch of people that work for the USGA. So Alex ended up working on the Live Golf event. They had a Live Golf event. He worked that event. He worked the US Senior Open. He worked the US Women's Open. And he's kind of developing this golf career for himself now. So I think that's a really important element of it. Whatever you're into, whatever it is that drives you, that you're passionate about, you need to get out into the community and work in that area and meet physical therapists in that area and network, because that's really the best way to reach your goals. So we really enjoy helping students with that, coming up with a customized plan. You're going to have a coach. One of the faculty members is going to be your coach while you're in school, and that you're going to meet with them regularly, constantly going over your goals and what we need to do to help you get to achieve those goals. Primary details of our program: we do one cohort per year. We start in September. We take 34 students, max 37. You can go like 10% over that, so we might max out at 37. So we're somewhere between 34 and 37 students in a cohort, and we have 8 14-week semesters. So you get a couple weeks off between each semester, which is sort of nice. You get a nice long Christmas break, pretty much most of December and into January. And we are fully accredited by CAPD, the accrediting body for physical therapy programs. This is our faculty. These are our core faculty. So there are 8 of us in total that are full-time. This is all we do is work in our PT program here. Dr. Weiss is the assistant director that runs the day-to-day operations in Green Bay. Dr. Buss has just started with us. She's our director of clinical education. That position used to be held by Dr. Messer, but she'll be onboarding here shortly, coordinating all things clinical education, internships, stuff like that. And then everybody else just kind of has different specialty areas. So we have a wide variety. You know, we try to hire faculty based on their specialty areas and have a wide variety of different specialists. We have 50 adjunct and lab faculty, 50. So these are the people that come into the classroom with you. Some of them lead a course. Most of them are lab faculty. So it's really, really important that we have clinicians that are in the clinic day in and day out, right? They have that relevant experience all the time. They come in and help out with our labs. They really enjoy this. It works really, really well. Ali is the one of the trainers for the Packers. He's a physical therapist, comes in and helps us out. We got a bunch of people that work over at Amplify, Aurora, Theta Care, Advanced PT and Sports Medicine, all sorts of clinicians that come in and help out. We're really, really proud of that. The quality of our adjunct faculty is, I think, a differentiator for us. I'm going to quickly run through the curriculum, not really in a lot of detail, but just give you a quick overview of some key points. So you start in the fall, you start in September. Obviously, you're taking your primary courses in the beginning. Anatomy, I talked about the cadaver lab, pathophysiology, that stuff. But what's kind of cool and what makes this program special is you're going to go and you're going to do this integrated clinical experience starting in the first couple of weeks of the program. So the whole first year of the program, you go into the clinic every Thursday and you rotate through. You might be at the YMCA one day. You might be at NEW Community Clinic one day. You'll be over at the hospital another day. You'll be at Titletown another time. You'll be at a lot of different outpatient clinics throughout the region. We make sure they're all within a 30-minute drive, so we don't want people driving too far, but we want you in the clinic every Thursday. That's very, very important because you need to learn by doing. You can't just learn in the classroom. You're not going to sit there and listen to a lecture and learn. That's not a great way to learn. You really need to go and physically do it. So if on Monday in clinical fundamentals, you learn how to measure range of motion of the elbow and you practice it on your classmate in Tuesday in lab, you need to be out there in the clinic on Thursday doing that on real live patients. That's really important. We pay those adjunct faculty for you to come to their clinic and they teach you in their clinic, right? That's really, really important. So the reason for that is we want them, the reason we pay them is we want them to know the curriculum really, really intimately, right? We want them to be strongly familiar with the curriculum and know what you need to learn in that session. So it makes for a higher quality experience. You're going to go all over the place. It's really, really fun, actually, because you're going to get to meet so many different physical therapists in the region. So this is actually in front of the hospital, the main hospital, and that's a really important one, right, to get exposure in the hospital. And it's probably 70% outpatient clinics, those experiences, and like 30% hospital and skilled nursing. So then in the spring, you're back for semester 2, and this is when things get a lot more clinical in the actual classroom. So courses like human movement science, where you're doing a ton of motion analysis and learning biomechanics at a high level. Neuroscience, where you're starting to learn more and more about neuropathology and stuff like that, but you're going to start treating patients. This lifestyle medicine course, so we have 4 courses where we bring a nutritionist in, a registered dietitian, to teach you about nutrition. We strongly believe that the physical therapist needs to be coaching people on proper nutrition. You're not a registered dietitian, you're not a nutritionist, you're not prescribing meal plans for people, but you can, it is within your scope of practice. You can tell people what an optimal diet is, right? An optimal diet, a healthy diet. You can teach people that, and you need to do that. So in second semester, it's lifestyle medicine, where you get a lot of nutrition content. Actually, in first semester, it's pathophysiology, where we have a nutritionist come into that course. We talk about gut health and the gastrointestinal system. And then in third semester, it's the Therapeutic Interventions 2 course, the strength and conditioning course. You get the nutritionist coming in there. But same thing, every single one of these semesters has an integrated clinical learning experience. So you're going out on Thursdays for that entire first year of the program. This is what typical schedule looks like. That's your summer term 3 semesters. So everybody's wonders like, how is it by class all day? More or less, we shifted to this model where we do 30 minutes between classes. It's so much better. Like I know you don't get out as quick or whatever, but when we used to do 10 minutes between classes. Class would go from like 9 to 9:50, and then you would get out and start the next class at 10. It's too rushed. You don't have time to decompress, hang out for a little bit, relax, get something to eat. It makes it much, much better day for you when you get those little bit of breaks in between. But it's still not a full day. It's really not that bad. So in this case, in summer, Tuesdays you're only really full day. The other days you're just in and out of class. Like I said, Thursdays are dedicated to that integrated clinical learning experience. And then in this case, we have some Fridays where you come to campus for exams and practicals and some coursework, but a lot of times Fridays are blocked off to study, get caught up. Then you come back for the 4th semester, and then what makes this kind of interesting is you're in class with us for the first 8 weeks, and then you go out for your first full-time internship. So you have 3 internships. One of them is short; it's only 6 weeks. That's kind of the intro internship, just get acclimated, and then after that, the other 2 are each 12 weeks long. I mentioned diagnostic sonography earlier. Sonography is a really important up-and-coming element of the physical therapist practice. So you can see in real time, like in this case, he's scanning the quad tendon, right? So if you're ever wondering, is their quad tendon torn? Is it just a tendonitis? I can't really tell what's going on in my physical exam. If you have that skill where you can scan, all you do is put the put the ultrasound machine on his quad tendon, and you can see right then in real time what's going on with that quad tendon. It's like an MRI. They use it in Europe a lot. In the United States, we don't use it because we make too much money off of MRIs, right? They make so much money off of MRIs, so they don't use sonography as much in the United States. But we have a medical sonography program where we train medical sonographers, and like what better venue to use that than with our DPT students. So this is embedded into your diagnostic imaging course. I teach this diagnostic imaging course. I teach you how to read MRIs, how to read X-rays, but then you go into lab and you work with these physicians and a couple other different providers that help you learn how to scan. So the internships are all over. People always ask, like, where am I going to do my internships? How does that process work? We have a huge list of sites that we have contracts with, and you basically pick your top choices. Most people get something in their top couple of choices, but it could be anywhere. It could be anywhere. We have sites in the East Coast, Southeast, West Coast. Obviously, most sites are in Wisconsin and the Midwest. If you never want to leave Wisconsin, we can definitely give you sites that are only in Wisconsin. That's pretty easy because we have most of our sites there. But if you want to travel a little bit, we've had students do quite a few internships in Arizona and Florida. So the first big one is in the winter. It runs from January through April. And so people like to go, Arizona and Florida. We've had quite a few people do that. One person went to Texas. But they're all over. I love seeing these pictures, everybody. This is the first day. We had people take pictures on the first day of their internship in front of the facility, and we put them on all our social media channels. Then you're back for one final semester with us to before you get out of here. This one's kind of interesting because you got so many different things. Wound care, physical therapists do wound care, so you do that. You have all these kind of higher level courses, and then Foundations 2, this course right here is all about getting you ready for your career. So it's all about launching your career, interviewing, job hiring, negotiating salary, all that stuff we get in there. We do a lot of board exam prep work for you. We have you take a mock board exam test to get you ready. We give you a course that you take on your own to get ready for the boards because the board's obviously a really big deal. Here's all our tuition information. I got this from our website. This is all up to date, but that's your total, basically 106 credit program, 96 grand if you add up all the tuition and fees. There are scholarships. We had, I think, 12 different students apply for scholarships last year, and they awarded, it was somewhere close to $40,000 in scholarships. So you can get scholarships. Obviously, they're not huge. You're dividing that across those 12 people, so most people get a couple grand. But it's worthwhile, I think, to look into, and our Bursar's office has all that information. Okay, to get in, it's gotten pretty competitive. So I think, Stephen, our average GPA last year was a 3.5.
Yeah, it was between 3.3 and 3.8.
Okay, so that's for the people that ended up getting into the program and joining the
Yeah.
program. But I wouldn't, if you're below a 3.3, it's probably gonna be a little challenging, but I wouldn't not apply if your GRE is really high. So the thing about like your GPA is hard to change. For those of you that are applying this cycle, the cycle that just opened, you'd want to interview for this November. You're entering your senior year of college, basically. Um, it's gonna be hard to make major changes to your GPA. Your prereq GPA could go up a little bit, like that you could do. But what you can control is your GRE, right? So what I would do is if I had a lower GPA, I would take the GRE. I would take a GRE prep course, but I would take the GRE until I'm happy with the score. 295 is very average, kind of lower end of average. If you can get that above a 295, you're going to be a more competitive. Um, I don't know, Stephen, what do you think? How many people were above a 300 in that class? I'm just off the top of my head thinking like 20,
For for
15.
the cohort that's starting this fall, I would say probably, did you say above 300?
Yeah. It's not that many, right? It's like 15 people maybe.
Right, right.
Yeah. So
About
like
half.
if you can get a 300 GRE, you're going to be pretty competitive, even if your GPA is
Yeah.
a little on the lower side. So I think if your GRE and then if your GPA is pretty competitive, you're like a 3.5, but you took the GRE once and you're sitting at a 289, take it again. Take it again. It's test taking is a skill. And I know the GRE has zero relevance to the physical therapy profession. It's a terrible test to say whether or not you're going to be a good it does nothing to tell whether you're going to be a good PT or even a good student. All it does is say whether you're a good test taker or not, which is probably going to help you pass the boards, right? And pass tests in PT school. But it's the skill. I would take it multiple times if I had to. I did. I had to take it multiple times. I was not happy my first jury score. I had to take a prep exam. Back then it was a big book. I remember reading this textbook and trying to take practice tests, and then I retook it. That's a good strategy. Two references could be from a college professor, could be from a PT. We're not picky about who these come from, right, Stephen? We're not picky. I think it could be. It's nice
Generally,
to see one.
we'd like to see one academic, one professional if possible, but if that's not possible, then whatever combination you have.
Yeah. We read your statement of purpose. They do get graded. Don't use AI. It's so obvious, and we have AI checking software. It's so obvious when it's AI. Just write it from the heart. It doesn't have to be scholarly. You don't have to be like some published author. We don't really care that much. It just can't have major grammatical errors, like that kind of stuff detracts. It needs to make sense. But honestly, the best thing is just write from the heart. And if you don't have a dramatic story of why you want to be a PT, that's okay. Just talk about why you love the profession, what you've learned about it, and what you want to do, and talk about your experiences that you've had so far. We like these to be unique to you. That's what we're looking for. Work experience, observation hours are really, really good. The number of hours isn't as important as the different settings. So if it's possible for you to go to an outpatient clinic, but then also maybe shadow somebody in a nursing home or a home health facility, or I know that's probably a little tougher, or a hospital or something like that. Going to a couple different facilities is good. Even a couple different outpatient clinics. So if you went to a big corporate clinic like a Athletico or a hospital-based one like Amplify, try to go to a small mom and pop clinic, and a lot of times those clinic owners are really welcoming and they want students to come in and shadow them because they like the idea of people being interested in the profession, and they like the idea of helping people. These are prerequisites. These are really important. I would say when you are lower, especially with your prereq GPA, anatomy and physiology are really important. We look at those, pretty carefully because those courses really do correlate to so many of the courses, obviously, that you take in PT school versus chemistry. Shouldn't say that, but chemistry.
I mean, yeah, it is what it is, though.
Yeah.
Physics is important. Yeah.
And we will take a biomechanics as a second physics. So if you have one physics and a biomechanics, we can take that. We'll look at them. You can always work with Stephen and he'll help you. He'll look at them. He knows which courses kind of we've approved in the past and we work together pretty regularly. Anything else you want to say, Stephen, about prereqs?
Just, I mean, I know that I've spoken actually to a lot of the students that are on right now, about just that sort of thing, about swapping out, if you will, like a biomechanics or even a kinesiology can swap out for physics. But if you have any questions about any of those and you're in that situation, just email me with your situation. If you can send us a syllabus of the class that you're wondering if you can swap out, then Dr. Chaconis and I will certainly talk it over and make it happen if it's